Welcome back to the Paul White Show. We're glad you stay tuned. Just before the break, I asked you if you like studies. Well, you might have an opportunity here to participate in the study that's going on right here locally in Wichita. My guest today is Dr. Tracy Collins, and she's affiliated with KU School of Medicine right here in Wichita. Welcome, Tracy.
Thank you.
This study that's going on now, you need to let me know what's up. What type of a study is this, and where is it going on at, and how long has it been going on?
So the study is focusing on patients with poor leg circulation, also called peripheral arterial disease, or PAD. Okay. And we know that PAD, because it's a blockage of the blood flow in the arteries that feed your legs, that walking is important to treat that. And what we're doing with this study that I'm conducting, which is funded by the National Institutes of Health, is we're looking at various counseling methods to promote walking in African Americans with PAD.
Oh, okay. So how long has this study been going on?
It's been going on about 2 years now. We have 3 more years, and what we're trying to do is find participants who can actually enroll in the study. And so what we're doing is we're looking for folks with risk factors for poor leg circulation, or PAD, and then if they're African American and they have one of these risk factors, we screen them for this disease.
Okay. So that's how you determine whether they can participate in the study or not, through screening?
Yes.
Okay. And you're screening them here locally?
Yes, we're screening them. Actually, we have a couple of approaches to screening. First step is that we can actually have an event out in the community. So people should stay tuned to learning about these events and keeping abreast of, like in the newspaper or radio, if they hear of a screening that we're conducting. And we can also invite them to come to the campus, and we can screen them there. The test we're using to screen for this disease is called the ankle brachial index, or ABI. And basically, we're putting blood pressure cuffs around the ankles and arms, so it's very much like having a blood pressure taken, but it's also taken in your ankle. And it takes about 25 minutes to complete the test from start to finish. And that test, if that result shows us that you have poor leg circulation, that's the first step for us to consider you for the trial. Okay. The next step then would make sure it's safe for you to walk in the community, make sure you don't have any concerning symptoms like chest pain, shortness of breath, that you're able to actually walk safely, that you don't need to consistently use a cane, and that it's actually something that you can participate in the actual trial.
Okay, so that's a good way to get off the couch.
It sure is.
Which I'm sure will help PAD. How many participants are you actually looking for in this area? I know sometimes it takes a lot of people to get the percentage that you want for the study to be effective.
Yeah.
You know, so how many are you looking for?
We are needing 204 African Americans, and right now we have about 27.
Okay.
So we definitely need a lot more people to enroll. And
okay.
Yeah, so if you feel like, you know, I mentioned risk factors. If you have diabetes, or if you smoke, or if you have high blood pressure or high blood cholesterol, and you're African American, certainly give us a call so we can talk to you on the phone.
Right.
Yeah, and we can go through that initial, at least, telephone screen, and then we can actually have you come in and we can measure to see if you have PAD based on that ankle brachial index. Okay.
So all they got to do is call to do the little pre-screening, like you said. So yes. They, you know, it's not a waste of time. They get down there and they find out that they can't participate in. Now, also, I know that I probably have seen this in the Wichita Eagle before, where you're looking for participants to participate in that. Yeah. But I guess sometimes you don't get a lot of people calling in. They see it, but then it just kind of go away, you know, unless they call right then. But I think I've seen this one, in fact, in the Wichita Eagle.
I know we're advertising currently in the Community Voice, and we're planning to start in the Eagle. And we do have some ads throughout the community, billboards on the sides of buses. So there are some advertisements out there now. Okay.
And in there, the ones in the newspaper, you don't actually fill it out and send it in. You still have to call the numbers, right?
Exactly. Okay. It's important to call that 293-3567.
Okay.
Yep.
Okay. And who should they ask for you?
No, actually, the person who picks up the phone, or if they leave a message, if we don't answer immediately, one of the research team members will call them right back.
Okay, so that's the team number right there for them to actually get right into it, to what's going on. Okay, now you mentioned African Americans. Is this exclusively for African Americans, or Can anybody else participate in it?
This trial, I've done other trials that were not exclusive, but because we've had challenges with recruiting certain minority groups into my other trials, I'm focusing solely on African Americans in this trial.
Okay. Now, transportation and all this kind of things, getting people there. If they don't have transportation, is there a way for them to get to the facility if they qualify to participate in it?
We do have vouchers to help them. We have bus vouchers to help them get to our site to get through the screening process. Yes, we do.
Okay, so there is a way to get them there and all of that.
Yes.
How long did this normally take, and how many days a week does this involve?
So getting into the trial takes that initial telephone screen and then confirming that you have PAD. And then we pay for a treadmill test in the community to make sure, again, that it's safe for you to walk from the standpoint that if you have poor circulation in your legs, you likely have poor circulation around your heart. And so we want to make sure that we don't have someone out in the community walking who's at risk for having a heart attack. So we look to see at their maximal effort, even though they may be limited by their leg discomfort, do they show any signs of poor circulation to their heart? If they do, then that has to be addressed by their physician before we'll enroll them. So there's that test, the exercise test. And then we actually put them through enrollment where we put them in one of 3 arms, depending on what number we pull up for them. So that's that first step where you have telephone, the ABI, the treadmill. Okay. Now, once we enroll them, once we put them into one of 3 arms, there are 3 arms in the trial. Then from there, they either have to go through 3 sort of telephone calls twice a month, and then once a month for 6 months. And that's not a lot if you think about it. That's not a major commitment. No. But those telephone calls are engaging them to figure out, what their issues are surrounding walking, okay? And then after the first 6 months, really, we don't have much interaction with them other than to check in on them. So it's 12 months of being involved. The first 6 months are what I just described, which are not that intensive, and then the latter 6 months.
So you are kind of on your own doing the walking?
Yes. And the goal is we're trying to get people to walk, and the counseling approaches we're using will help to motivate the walking. But what we're trying to figure out is which counseling approach is best. Yeah.
Okay, Dr. Collins, we'll have to take a commercial break, and we'll be right back. I'm visiting with Dr. Collins from KU Med on PAD. Stay tuned.